very much indeed. Lots of very important information there. And thank you, Mike, for your intervention. I think now this is where we go back to Jonathan and Simon. So,
good afternoon. It's less the Jonathan and Simon Act and more the Jonathan Act at this point anyway, although I'm sure we'll be hearing from Simon shortly. And it's like, where do you go from there, from that graph and the challenge of the money? And it's kind of everyone saying, yes, this is now over to these new leaders, the GP Consortia, who are going to make it all right. Well, we shall see. But who are we, first of all? I want to tell you a little bit about who we are and what we're trying to do. So I'm Jonathan Griffiths. I'm a GP working in Swanlow practice in Winsford. I've been working there since 2005. And before that, I was a GP in South Staffordshire. And the Vale Royal Commissioning Consortia is 12 practices that make up the practice from Winsford and Northwich, essentially. So if you live in Winsford or Northwich and have a GP there, you are likely to fall within the consortium area. And that covers 64 GPs. That's including both partners and also salaried GPs. And about 102,000 population. And we're coming together to ensure that we can get high quality healthcare services provided to all in Vale Royal. And it's about introducing local clinical leadership into the commissioning process. So what are we trying to do? And I guess one of the questions this afternoon is, well, you know, what are we doing in this pause while they look at the health bill? And how can we plan when we don't know where we're meant to be heading or what the policies are going to be? So what we feel we need to do is, first of all, determine our values as a consortium. And we've done an exercise, and we've come up with 4 values that we think we stand for. Quality, integrity, innovation, and being patient-centred. So quality is expecting high-quality care from ourselves as GPs, but also from our partners as well. And it includes building on what we feel is high-quality care being provided in the community by our GPs day by day, and expecting the same from secondary care, from hospital care, when that is required. We also think that quality care doesn't necessarily mean more expensive care. And if you get things done right the first time, then it's done right the first time. You haven't got the repeated, let's try and get it right now, let's try and get it right now, let's try and get it right now. Let's be more effective with our healthcare. Integrity, we all strongly felt that we needed to do the right thing at all times. And that includes obviously the quality care, it includes how we deal with the finances that are incredibly challenging at the moment. Innovation. We need to do things differently. Mark has already said that in his presentation. If you do what you've always done, you'll get what you've always got. And as we can see, we just don't have the money anyway to do what we've always done. We have to innovate. We have to do things in a different way. And being patient-centred, that is surely what it's all about. And it's great to be here this afternoon and to actually engage with patients, the public, whatever you want to call all of us, who are all patients at the end of the day somewhere. We feel we need to do our values and then determine our vision. And again, we did an exercise with a GP from each practice in our consortium, and we've come up with, this is our latest expression of our vision statement. We aspire to be an outstanding consortium, working together with patients and partners to ensure affordable, high-quality healthcare for all. So the key things about that for me is that we aspire to be an outstanding consortium. We don't just want to get in there and do okay, and do what we need to do. We want to be the best. And actually it also says that there's no reason why we couldn't be the best at doing this. If it can be done anywhere, it can be done in Vale Royal. We want to be working together. We can't possibly do this in isolation. We need to work with our partners, with the hospitals, with the local authority, and with with the stakeholders and our patients. To ensure affordable, high-quality health, we've already talked about the high quality and the innovation, because we have to do this within the resources that we are given. So what does that actually mean that we need to do? We need to use the public health information that determines the needs of the people available, or rather demonstrates the needs of people available. And we've seen that from Heather. So heart disease, diabetes, stroke, for example. We need to ensure that any plans that we have fit in with our values and our vision and are tackling those areas, and work together with our partners to realise those plans. The health needs of people, our values and our vision are not dependent upon national policy. So actually we can plan and do these things regardless of the results of the polls that we currently have. Thank you very much.
Thank you very much for that presentation. I'm sure you're going to have an awful lot of questions. Thank you. Finally, we come to question time, which gives you all an opportunity to ask questions of an expert panel. Do have your questions ready. If you do have a question, please raise your hand and a roving mic will be brought to you. Your questions and views are very important to the Consortia and the rest of the senior people here representing health and social care. And they could affect how the services are shaped and commissioned in the future. I'm going to hand you over now to the chairman of the panel, Geoffrey Appleton, who will introduce you to the panel. Geoffrey is chairman, Cheshire West and Chester Adult Safeguarding Board, and I'm pleased that Geoffrey took